So in this MonumenTAL-1 study, the significance of this is the recommended phase 2 dosing, and it's the update. I should mention that at this time of this abstract, the New England Journal paper will be out on the phase 1 portion. So this is the phase 2, recommended phase 2 doses. And there were basically 3 cohorts in this study. One is 0.4 milligrams per kilogram weekly. The second is 0.8 milligrams per kilogram every 2 weeks. And third is either of those doses, but in patients with prior T-cell redirection therapies. And basically what we're seeing is in the first 2 groups, the response rate was 73 to 74%. And in the second group, which is the prior T-cell redirection, the response rate is 63%. And I think these are outstanding results given how heavily treated these patients are, with a high representation of triple class refractory to last line of therapy, including extramedullary ISS3. The median duration of response was over 9 months, which is also quite encouraging. And finally, I would say that the drug's adverse event profile is very important to discuss. We did see some unusual for bispecific and T-cell redirections off-target toxicities that are due to expression of GPRC. And that includes loss of taste, and related to that would be weight loss, dry mouth. We see some skin rashes and nail changes. Those are all primarily grade 1 to 2, so they didn't lead to discontinuation of the drug for the most part. And importantly, we did not see a lot of infections, COVID-related deaths, or cytopenias other than in the initial few cycles, which I think this makes it an excellent candidate for combination therapy. So regarding where Talquetamab fits in the myeloma armamentarium, BCMA is such a competitive space. I feel like BCMA bispecifics are like the statins of myeloma. And it seems like every day there's another one. And of course, we have Talquetamab that's FDA approved, but many others in development. We also have 2 commercial CAR Ts targeting BCMA, but there's a dearth of other targets. And I think that's what's exciting about Talquetamab. It is a non-BCMA target. And as I alluded to, the safety profile makes it really a good agent to combine with other things. And that includes studies that are going on are daratumumab with pomalidomide and steroids, with teclistamab, so Tec-Tal, if you will, and then also checkpoint inhibitors. And the pivotal phase 3 study that's going on is basically Dara with Talquetamab, or with Talquetamab with Pom and Dara in combination with Dara-Pom-Dex. So that's the reference arm. So it'll be interesting to see how this pans out, but I think it's really exciting for patients to have a non-BCMA option that's working so well in so many patients.